Welcome back to the Seattle Convention Center. We're here in downtown Seattle for the 27th Annual Alzheimer's Association Regional Conference, and things have already gotten underway. The keynote address has just taken place a few moments ago. Get an opportunity now to chat with some of the folks that are here representing various organizations, of course, an interest certainly from local healthcare here in the Seattle area, and we bring in Chris Rhoads, who is with Virginia Mason Medical Center here. He's a neuropsychologist there and also the director of memory disorders there, the Memory Disorders Clinic that they have. We'll talk with Chris some more about what his function is, what brings him here today, and also about rural healthcare in the state, and in specific his areas of expertise. Dr. Rhoads, thanks for the time. What does bring you to this conference today?
Well, apparently I'm presenting at some point, so and my voice isn't fully cooperating. But no, I've been to this conference for years, and always appreciate the opportunity to meet other providers and families and other resources in the community as well. But presenting later today about neuropsychological assessment and whether or not that's a necessary component in the evaluation of memory loss. So that's my function today, and just enjoying the presentations otherwise.
And I imagine that there's still a learning process going on, not only within the general community, but also even within the medical community, as we just heard from Dr. Gary Small about. It was the keynote address today. Still a lot to be learned and discovered about all kinds of cognitive disorders. In your specific area, though, of neuropsychology, what are some of the advances and discoveries being made currently?
So within neuropsychology, we're doing a lot more work integrating with other diagnostic procedures and components. So one big interest that we have at Virginia Mason is structural brain imaging combined with cognitive test scores, and how does that increase the accuracy of diagnosis and then prediction of, is this a static cognitive impairment, or is it going to get worse over time, and at what rate? So we're doing a lot in that area, as well as I'm primarily interested in rehabilitation, if possible, or any kinds of treatments that you can design. So what I love about what I do is I get a good sense of strengths and weaknesses, and then, okay, so if you do have memory deficits, what part of memory is affected? How do we design some compensatory strategies or devices to keep you functioning well at home for as long as possible? So we're really pushing that too.
Okay, very good. I know that we heard a lot about how the physical body actually ties into our brain, and keeping our brain active and sharp is obviously one of those things you'd think of immediately. Brain health, though, connects so widely, it seems like, with the entire human body. What is being discovered there as far as the neuropsychology level? Are you able to kind of spread out and look at other things besides just the brain itself?
Yeah, absolutely. So one thing that we look at too is when we get somebody on a program of physical activity or a dietary change, we can see changes in the brain, whether it's increased connections, better blood flow, but we also see things like less depression, less anxiety, better stress coping abilities, and people generally feel better. They sleep better, they metabolize food better. So there's all sorts of benefits. The challenge is, and you heard some of this morning, is how do you get someone doing that who hasn't been doing it, or doesn't really want to do it, or is just stuck. So that's what I like about what I do too, is that we address things from all angles, including motivation and enhancing motivation and soliciting people's motivations for, why your providers want you to exercise or stop smoking. Why do you want to, and how does that help get you there?
And it sounds like as we look for a cure, which there isn't one yet, and again, there's still a lot of questions out there in particular about Alzheimer's, but I imagine about everything else that would have to do with brain function as well. Dr. Small mentioning that people just want to pop a pill and forget about it. This is an area where prevention is really going to be critical, regardless of whether a cure is eventually discovered or not. And I know that's one of the areas that you really want to focus on as well, Dr. Rhoads, in your practice.
Absolutely, and that's right now we're really spending a lot of time diagnosing and treating folks who have full-blown dementia or Alzheimer's disease, vascular, frontotemporal, whatever it might be, with an emphasis on catching people early so we can intervene. Because if we wait too long, there's not much we can do. And the real focus of the Memory Disorders Clinic at Virginia Mason is to address things in midlife. When people are in their 40s, 50s, maybe 30s, if your blood pressure is high at that point. And how do we really change your risk for these diseases, or when they start, or how severe they become, but we really need to catch people early, because that's the time to intervene.
Dr. Rhoads, I'm curious to know, and I'm sure this is something we'll ask of Dr. Small as well when we get a chance to chat with him in just a little while, but you talked about already, and he mentioned this in his keynote address too, getting people to do these regimens, these programs you put them on is a whole other thing than tossing it out there and saying it would help you. However, I'm wondering about people even being cognitive of their own mental health, of thinking of their brain as something that needs to stay healthy, because it seems like it's not a target area that might make a big impact on people if they're just fine, especially earlier in life. But if there's the threat of a heart attack, if there's the threat of something else to their body, it might be easier to get them to do something. Is that something you see in your practice?
Oh, absolutely. You know, and the folks that seem to have the motivation there, if they're not experiencing changes already, and say, well, you know, I'm doing fine at work, I'm doing fine in my activities, if they have a family member. You know, so if they're at increased risk because of genetics or their family symptoms, they tend to be a little bit more motivated, and that's the kind of the crowd that we're starting to work with first, and learning what works, what doesn't in terms of motivating people earlier in life. And I think as people learn more about Alzheimer's disease, you know, it's interesting to watch how the media has handled this, and you know, people's reactions to it. I see people in the clinic who are in their 30s, late 30s or 40s who are afraid of getting Alzheimer's disease now. I didn't see that 10 years ago.
Wow.
Unless they had a family member who developed it in their 40s or 50s. So.
And is that extremely rare? We do tend to associate Alzheimer's with something that happens later in life, degeneratively speaking, 70s, 80s, maybe even older. But are we seeing a lot more cases right now with folks even in their 30s developing this disease?
You know, it's rare in 30s, you know, or the early onset forms. It seems like, you know, early 50s, some late 40s. That's not as rare. It's still rare compared to later onset, so after age 65. But there are, what's the estimate, about 550,000, almost 600,000 people in the United States right now with early onset Alzheimer's disease. So it's not as rare as we'd like it to be.
I guess it's a double-edged sword always. You never like to hear that people are worrying about something, but at the same time, you do like to know that they're at least thinking about it. That means that the message is getting through, or is able to get through when it's delivered.
Right. In my discussions with folks is, you know, if you're worried to the point that it's stressing you out and you're getting anxious, that's not productive. But if it can help motivate you to do something, to institute some changes in your life, great.
Yeah, absolutely. Dr. Rhoads, won't keep you much longer. Just one more thing I wanted to know about is your connection to rural healthcare here in the state. You are obviously with a large healthcare facility here in the Seattle region with Virginia Mason, but what contacts do you make as far as spreading out into more sparsely populated areas of Washington?
That's a good question, and that's actually, you know, coming from a very rural place. You know, my background is very important to me, and one thing I do, you know, I think last year I did about 19 talks in Washington and one in Alaska, out in rural places, and that is primarily an educational drive to try to raise awareness and let people know what resources are available, but also networking with regional physicians. So Virginia Mason has a very large regional clinicians program, so we get a lot of folks from the peninsula. We have patients who drive over from Richland, Kennewick, Spokane at times. And what we're trying to do now is to partner with other regional hospitals to help them develop tools and protocols and programs that identify things early, intervene appropriately, and if needed, send, you know, folks over for more complicated diagnostic workups, but then get them back in their communities. So it really, and I think this year I've got about 10 or 12 talks so far. Wenatchee, Yakima, Bellingham, you know, they're kind of spread out.
Well, it's great to know that you're targeting every area of the state. It seems like some of those rural pockets can easily be deemed to be forgotten, I guess, but it looks like Virginia Mason is at least staying sharp as far as their angles are concerned all over the state and making sure that you're out there to help. Again, Dr. Rhoads, I appreciate the time. Anything else you want to offer to us today on this discussion, the front of the Alzheimer's conference here and whatnot?
You know, the only thing I would offer, and we've been hearing this. Well, I'm very happy that you're here doing this. This is wonderful, and I think it helps serves the purpose of increasing education and awareness. But two, you know, people still, I think of Alzheimer's disease or other advanced, you know, dementias as it's a part of aging, or it's something that we can't do anything about. And I think what you're hearing more in the last 2 years is around prevention. You know, we've always hoped that the vaccines would work, or there'd be a cure, or we'd have treatments that would modify the disease. It's such a complicated disease, particularly Alzheimer's disease, that we really do need to focus on prevention, and I don't think it's ever too late for prevention. So, you know, people would say, oh, I've already got problems, you know, what's the point? Well, let's not develop anymore.
Yeah, and I think it's definitely forcing people to think about their brains too as part of their bodies. I really think there could be a disconnect there where it's easier to target other parts of your body that you think might go first. And again, you're removing the stigma at the same time, Dr. Rhoads, as far as the fact that it's not just a part of getting old, doesn't have to be. We can stay mentally sharp well into our golden years. Dr. Rhoads, appreciate the time again, and
Thank you so
thank
much.
you for your time.
Yeah. All right.